अथात तृष्णाप्रतिषेधम् अध्यायं व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः. Trishna means thirst. Thirst, of course, is a physiological response which is naturally seen, and it's one of the essential factors which keeps the body in normal physiology. But when it becomes abnormal, if there is an excess of thirst, that's called as a Trishna Vyadhi. Now, in the contemporary situation, you do not have such a disease like thirst as a disease is not seen, but thirst could be the symptom of many other changes in the body. Abnormal pathology can result in excess of the thirst. Now, definition of the Trishna Vyadhi in Sushruta would be Satadam Yapiped Vari Natruktim Adhigachati Punah Kankshati Vayam Chatam Trishnadam Adhishetam. If a person feels thirsty even after drinking sufficient amount of water, and still he wants to have more and more water, that condition is called as Trishna. And the causes are Sanshobha, Shoka, Shrama, Madhyapanat, Ruksha, Amla, Shushka, Ushna, Katu, Upayogat, Dhatukshayat, Langhana, Surya Tapat, Pittancha, Vatascha, Brisham Pravurtho, Srotam Sisandu, Shedat Sameto, Yani, Ambuahini, Sharirinam, He, Srotaso, Apam Vahishu Dushideshu, Jayet Trishna, Atiparatastu. The causes for the Trishna Vyadhi could be either psychological stress or even feeling of distress or excess of exercise, alcoholic drinks, consumption of alcoholic drink, junk food like Rukshamra, Shushka, Ushnakatu, these are all the junk food like Adhatukshayata, due to systemic disorders where the dhatu nourishment of the body is not proper, or Langhana, the insufficient quantity of the food, or exposure to the sunlight, it results in involvement of Pitta and Vata, and that results in the Sota Drushti and Ambuahi Sotas, Udakavaha Sotas would be affected, or mechanism of maintenance of the homeostasis of the fluid would be affected, and that results in Trishna. Tisraha Smudahata Kshatraja Chaturthi Kshayatata Anya Amasamudbhavacha Syat Saptami Bhakta Nimittajacha Nimit Nibodhalingani Anupurusha. So there are 7 types of the Trishna Vyadhi discussed based upon the Vataja, Pittaja, Kapaja, and Kshatraja is due to the injury, or Kshayata due to emaciation disorders or improper nourishment, Amasamudbhava due to improper accumulation of improper metabolic products, or Bhakta Nimittaja due to the food, type of the food, it can result in the Trishna. Now, the mechanism of thirst, as the physiology is known, is a physiological mechanism to maintain the fluid content in the body and keep the blood in a isoelectric condition. The osmolarity of the blood is one of the important issues to maintain the nourishment throughout for each of the substances, nourishment as well as the other electrolytes to move across. And if there is any the extracellular fluid is decreased, that results in the osmoreceptors in the hypothalamic area to get stimulated, and that results in the stimulation of the thirst center, which produces a sensation of the thirst. Or if there is a osmolarity of the extracellular blood is increased, so either osmolarity, the quantity of the volume of the extracellular fluid is reduced, or if the osmolarity is increased, that results in the decreased saliva secretion, there will be dry mouth, and that also stimulates the thirst center. And once the thirst center, the water is consumed, and that consumed water itself will produce a reflex action, and the osmoreceptors are the most important parts in maintenance of the balance of the water. And that's how the fluid consumption is maintained. The fluid excretion is mainly regulated through the renal. Of course, sweat also is another mechanism, and naturally there will be some evaporation of the water, which is normal, but the most important part of the regulation of the water content in the body again is based upon the osmolarity basis only, and it's mainly by the kidneys. And again the osmosis occurs at the glomerulus, and the sensation of they are sensing this would be in the proximal tubule as well as in the distal tubule. Mainly the distal tubule, the osmolarity of the fluid is maintained, sensed, and based upon that the total water content which could be excreted or retained in the body would be maintained. And this also is regulated by antidiuretic hormone ADH, which ultimately maintains the osmolarity of the body. So basically there are two important issues. One, the regulation of the consumption of the fluid by the thirst center, and then the regulation is by the renal mechanism. The abnormal hydration can occur either a decreased intake or increased output in the renal or gastrointestinal tract, or exposure to the sunlight which produces the insensible loss. Or there could be a fluid shift also can produce abnormal hydration, like as in case of the ascites, effusions, where the extracellular fluid shifts to some other compartment, and hence the total volume available for the circulation becomes reduced. Or in the patients where there is a leakage of the fluid from the capillaries, like as in burns or sepsis, there could be leakage, and that also can result in the dehydration. And that dehydration is now categorized as a isonatremic, hyponatremic or hypernatremic, depending upon the osmolarity or the level of sodium. As long as the sodium is normal, but the total quantity of the fluid in the body, extravascular as well as intravascular compartment of fluid, is reduced, that is called as isonatremic. If there is a situation where the sodium content is less than normal, and hence that patient would have a abnormal fluid cut mechanism in the body, and what happens in that condition, when the sodium content is reduced, that results in the increase in the quantity of the extracellular fluid, but that extracellular fluid increase is due to shift of the fluid from the intravascular compartment. So net water content in the body in that condition would not be affected, but the cells will be dried up because of the shift of the fluid from the intravascular compartment to the extravascular compartment. From the extravascular compartment. So because of that shift, it results in the depletion of the body contents, and signs of dehydration would occur. Hypernatremic is where the sodium content is increased and the total water content in the extracellular fluid is hypernatremic. That results in drying up of the tissues. Then there are also usually neurologic complications can occur as a result of the dehydration in hyponatremic and hypernatremic conditions. Isonatremic dehydration rarely produces neurological complications, and the very common causes of the dehydration are like gastroenteritis, where there is a persistent vomiting, diabetic ketoacidosis, where the metabolic changes would occur, burns in the fluid losses may be very severe many times, which are not really recognized, congenital adrenal hyperplasia or any other acquired adrenal pathology, which may be associated with the hypoglycemia, hypotension, or even reduced potassium concentration as well as reduced sodium levels. So that makes it, adrenal pathologies often produce more complicated clinical picture. Patients who have a obstruction in the gastrointestinal tract, which results in vomiting as well as reduced absorption, and when there is a ischemia of the intestines, that results in excess of leak from the capillaries. So all the three mechanisms, they come into the picture in case of the obstructions, and that produces more severe dehydration. Heat stroke is another condition, or hyperpyrexia, where the total body temperature increases. The typical presentation would be dry skin with the changes in the mental status would occur. Conditions like cystic fibrosis, where there is excess of loss of sodium and chloride from the sweat, resulting in hyponatremic conditions, and are hypochloremic also, like potassium level as well as sodium level would be reduced, and that results in dehydration. Diabetes as such, even without ketoacidosis, diabetes by itself would result in excess of the water loss in the form of polyuria, and that results in hypernatremic dehydration. Thyrotoxicosis also, where there would be there could be rapid metabolic activity, increased metabolic activity, the water content would be more, and in some of the patients may have diarrhea. Reduced intake of water due to any reason, of course in diseases like stomatitis, pharyngitis, or patients who are semi-conscious or unconscious, or any other reason where the total water intake is reduced, that also can result in the dehydration, and that would be a isonatremic condition. Now, the clinical signs of this Trishna Vyadhi based upon the dosha would be Kalu, Osta, Kantha, Astya, Vishosha, Doha, Santapa, Moha, Brahma, Vipralapaha, Purvani, Rupani, Bhavanti, Tasam, Utpatti, Kaleshu, Vishesha. The initial clinical symptoms of the Trishna is a dryness and burning sensation in the palate, oral cavity, or neck as such, or it can result in a distress, feeling of distress, or altered consciousness, or many times hallucinations and illusions also can occur in the early stages of the dehydration. In Vataja Trishna, शुष्काश्चेता मारुतसंभवायां तोदः तथा शंख शिरस्सु चापि स्रोतो निरोधो विरसंच वक्त्रं शीताभिर्दिष्ट विवृद्धिमेति. In case of Vataja variety of the Trishna Vyadhi, the dryness of the mouth along with the headache, severe pain in the forehead as well as in the temporal area, and the patient would not be able to appreciate the taste in the mouth, and this would be, the thirst would be aggravated by drinking cold water. This is what we generally see in the summer season. In the summer season, when the patient, there is a tendency for dehydration, if you take more cold water, the thirst would not be satisfied. The sensation of thirst would not be satisfied, though people continue to take cold water, and that's typical of Vataja, this Trishna. Or it's often due to the excess of the loss of fluid. Excess of the loss of the fluid would be presented with these kinds of the symptoms. Then, Mucha pralapa aruchi vaktrashoshaha pitekshanattvam pratishthilaha shitapikamsha mukhasiktalacha pittatmikayam paridhupananja. In patients with the Pittaja variety, the patient may have impaired consciousness, or even altered consciousness, or dryness of the mouth. There could be yellowish discoloration in the body, or a appearance itself, the shrunken eyeballs like appearance, and dryness is a bitter taste in the mouth. These are often produced due to excess of water loss. When you see the patients with the diarrhea or vomiting, gastroenteritis like conditions, they tend to present with the typical Pittaja Trishna Lakshana. Kaphavrtabhyam analabhyam kapopi shushkah prakaroti Trishna nidra gurutvam madhura taya ardita shushyati chati matram. Now, in the Kaphaja variety of the Trishna, the patient would be somewhat less active, feeling sleepy, heaviness in the body, and there could be even sweet odor in the mouth. These kinds of features are often seen in metabolic pathology like these diabetic ketoacidosis or anemia like conditions. The patient would have exactly the same clinical symptoms. So, Vataja, Pittaja, Kaphaja variety of the Trishna can be now identified with these different conditions. Then Kanthopadepaha Mukhapichilatvam Shitadvaraha Chatya Rochakascha Kapatmikayam Gurugatraja Shakhasu Shopastu Avipaka Eva. Now, in case of Kaphaja condition, along with that, there would be Kanthopadepaha, even there could be a stickiness in the mouth and Pichilatvam, slimy contents there. And Shitadvaraha, the total body temperature may be reduced, vomiting also could occur, and Gurugatraka and Shakhasu Shopaha, edema, which is again very characteristic in case of the edema-like conditions. Etani Rupani Bhavanti Sasyam Taya Ardita Kamshati Chati Nati Jambaha. Even Kaphaja variety patients may have all the clinical signs of dehydration, but he may not have a urge to drink water. Shatasya Rukshonita Nirgamabhyam Trishna Chaturthi Kshatajamatato Taya Abhiputasya Nishadinani Gachanti Dukkam Pipatopitovayam. In Ksataja, where injury has occurred or total blood loss has occurred, patient who is in a shock condition, due to the loss of blood, the Trishna, excess of thirst occurs. Now, this is where the patient would have a hypouremia-like condition, and in such conditions, simply drinking water alone would not be enough, and the patient would have severe distress. Then Rasakshayadya Kshayajamtasa Tayardita Shushyati Dakhyateja Arthertam Akanshati Chapitoyam Tam Sanipata Iti Kechilabhu. Due to the Dhatu Kshaya, mainly rasakshaya. The patient would have a burning sensation and he will be looking emaciated. This and he will be urging for more water, and all the other rasakshaya lakshana could occur in such conditions, and this is also called as tridosha. This often occurs in case of the hormonal pathology, like patients who have adrenal pathologies or patients who have thyroid hyperthyroidism pathologies. Exactly the same clinical symptoms would occur. And त्रिदोषलिंग आमसमुद्भवात् हृच्छूलनिष्ठीपनसाधयुक्ताः आमसमुद्भव, that's due to consumption of improper food, and then you will feel thirsty. This is common, and this is what a tridosha variety, where the patient may have pain in the chest and excess of salivation, or even nausea can occur. Then strictam tata amlam lavanam jabukkum guruannam eva atitrusham karoti. Having spicy food would result in a feeling of excess of thirst, which is a very common experience. Kshiram vichittam badhiram trishartam vivarjayet nirgata jihvam ashuhu. In a patient who is having dehydration, if the patient is very much emaciated and he is not conscious, he is not able to hear, his hearing sensation is affected, such or nirgata jihvam, if the tongue is protruded out, he is not able to take the tongue in, that means the reflexes are affected. Such condition is considered as asadhya. Now, in the present day situation, dehydration is the cause of the dehydration has to be assessed based upon the disease conditions which we have discussed. But once the patient comes to you, the first of the important would be the severity of the grade of this dehydration has to be assessed, and then the planning of the management, the supplement of water or the other water will electrolytes has to be planned, and hence we generally follow these clinical criteria. The clinical criteria to decide like mild or moderate or severe dehydration is when the patient is normal alert and the capillary refilling time is less than 2 seconds and the mucous membranes seem to be normal, and the patient would also have the tear discharge, heart rate is within 80 per minute, and respiratory rate also is normal. We consider this as mild dehydration by the clinical science. Whereas if the patient is lethargic and the capillary refilling time is 2 to 4 seconds, the mucous membrane seem to be dry, tears are decreased, heart rate is increased, and respiratory rate also is increased, then it's moderate. In severe, the patient may have somewhat uptrended, that means he is not able to respond to the stimuli properly, and the capillary refilling time are more than 4 seconds, and the limbs are cold, and the mucous membrane is very much dry and cracked as such. Tears are absent, heart rate is severely increased, usually more than 90 per minute, and the respiratory rate also is very much increased. Along with that, if the blood pressure and pulse rate, the skin turgor, the elasticity of the skin, particularly in children, fontanelle in children, the presence appearance of the fontanelle and appearance of the eyes and urine output also are another criteria by which you decide whether the dehydration is mild, moderate or severe. And in the another part of that would be estimation of the fluid loss. Now, estimation of the fluid loss particularly is very much crucial in pediatric practice. In adult, of course, a slight error in estimating the fluid loss may not affect much, but in children it's quite necessary. And in pediatric practice, assessment of the dehydration in terms of the total amount of the fluid loss and then replacement, quantity of the fluid to be replaced are very critical, as well as rate of infusion also is very critical, and hence this clinical formula is usually followed. If the child is less than 10 kilo and it's categorized as infants, if the child is more than 10 kilo, we generally consider this as a bit upper category of the children. And if in a mild hydration where the fluid loss is 5%, like or it's a 50 milliliter per kilogram, if there is a moderate dehydration, the signs like mild, moderate, which you have discussed, based upon that signs, we estimate like in a infant it would be like 50 milliliter per kilogram body as the amount of the fluid which is required to be placed in that patient. And in children, like about 10 kg, it's around 30 milliliter per kilogram. And in the moderate dehydration in an infant, this is again important, like the percentage of the fluid lost in an infant is much more than the adults or later life etc. There you will have to give 100 milliliter per kilogram body weight as a replacement, whereas if the child is above 10 kilogram, 60 ml per kilogram is given in moderate. Severe is 150 milliliter per kilogram, and in the more than 10 kg child, it's 90 milliliter per kilogram. This is how it has to be assessed. Now, Trishnapratishedha udarecha purne vamayet magadhika udakajana विलोभनं च प्रहितं विधेयं स्यात् दाडिम आम्रातक मातृङ्गैः त्रिस्सत् प्रयोगैः इह सन्निवार्याः शीतैश्च सम्यक् रसबीजजातैः. Now, if there is excess of thirst, the treatment protocol mentioned in Ayurveda would be, you will have to give vamana with the maghadika rasa, that's pipari kashaya, it has to be done. And vilobhanam cha, the patient, counseling of the patient also can be one of the issue. Or dadima amrataka matlunga sarasas or kashayas can be given internally, and cold water has to be given, and patient has to be kept in a cold environment. Gandusham amlehi virasecha vatre kuryat shubhaiha amlakasya churnehi. If the patient is not able to appreciate the taste in the mouth, that dryness in the mouth can be reduced by gandusha, gargling with the sour substances and or amalka churna. Suvarna rupyadiभिः अग्नितप्तैः रोषैः कृतं वा सिकताभिर्वा जलं सुकोष्ठं क्षमेत तृष्णां सशर्करं क्षद्रयितं हिमं वा. The water given should be processed in such a way that heated metallic substances like gold or silver should be dipped in, and or maybe the sand or maybe the mud also could be used for that same processing the water. And with the sugar, that kind of water is taken in. This is to add mineral to the water. It's not that the plain water has to be given. Some mineral substances have to be added to the water, and to have that the mineral containing water, the process is dipping these heated metallic substances or heated mud ball or heated sand is added to the water, and then the water is purified and taken in. पंचांगिकाः पंचगणाः ये उक्ताः तेषु अम्बु सिद्धं प्रथमे गणे च पिबेत् सुखस्थं मनुच अचिरेण तृषौ विमुच्येत हि वातजायाः. Among the Panchangi ganas, it's Trinapanchamula and the Laghu Panchamula, Brihat Panchamula, those have to be, any of them could be used for processing the water in case of Vataja variety of Krishna Vyata. पित्तग्न वर्गे कृतकषायः सशर्करः क्षौद्रैः सुषितः पित्तस्त्रषां पित्तकृतां निहन्ति क्षीरं शतं वापि अथ जीवनीयैः. In case of pittaja variety of the Trishna, where the patient have the signs of pittaja lakshanas, where dehydration and fluid loss, pittagna varga kashayas are to be used, and they have to be given in cold form. And in the Kaphaja variety, bilva adaki kanyaka panchamuladiभिः मूली दर्भेषु सिद्धं कपजां निहन्ति हितं भवेत् छर्दनमेव चात्र तप्तेन निम्बप्रसोदकेन. In the Kaphaja variety, bilva adaki etc. have to be used for processing the water to be consumed, and even vamana is suggested as a primary treatment. Sarvasu trishnasu athavapi paitam kuryat vidhim tena hi tahana santi. In all other types of trishna, pittaja variety, pittaja protocols of treating pitta Krishna have to be followed. Pariyagata udumbarajораsastu sasharkarah tat kvachitodakam cha vargasya siddhasya sarivadehe patavyam ambhasya shiram strishartihim. Cold water processed with the udumbara and sugar has to be consumed, and sarivadikana dravyas also could be used for consumption in general in all variety of Krishna. Kasheru, Shringata, Padma, Mocha, Bimba, Bisa, Ikshu, Siddham, Sharjam, Ehanti. In Kshatraja variety, these drugs are used. Laja, Utpala, Ushira, Kuchandanani, Gatwa, Pravate, Nishivasayetu, Taduttamam, Toye, Mudara Gandhi, Sitayitam, Chaudritam, Modanti, Draksha, Pragadam, Hitayat, Vedya, Krishna, Debyu, Vitayat, Narebhyaha. Another common this alternative to supplement water intake would be the water processed with Lada Utpalavushira etc. with the sugar and honey. ससारिवादौ तृणपञ्चमूले तथा उत्पलादौ प्रथमे गणे च कुर्यात् कषायन्ते यथेरितेन or सारिवादिगण पंचमूल etc. can be used. मधुक पुष्पादिषु च अपरेषु राजार्दन क्षीरि कपितनेषु षट् पानकानि अत्र हितानि च स्युः. These panakas with the राजार्दन क्षीरि also can be used. सतण्डिकेराणि अथवा पिबेत्तु तुष्टानि कार्पास समुद्भवानि क्षतोद्भवां ऋग्विनिवारणेन जयेद्रसान् आमसृजष्टपानिः क्षयत्तां क्षीरदुतं निहन्यात् मांसोदकं च मधुकोदकं च. In case of the kshatodbhava, that's the injury producing or blood loss conditions, even rugnivarana rasas, the rasas which can reduce the pain, or it could be directly the consumption of the blood. That's important. Blood also could be drunken in according to Sushruta in case of a hypovolemic conditions due to blood loss. Then Kshaya variety, where there is an abnormality of nourishment and the patient is poorly nourished, Mamsodakam or Madhukodakam also can be given. Amodbhavam Bilva Vachayitaistu Jayet Kashayehi Atha Deepanihi Amrata Bhallataka Balayitani Pivet Kashayani Atha Deepanani. In Amaja variety, Deepaniya Dravya or Bilva and Vacha also can be used. Guruvana Jatam Homane Jayet Chakshaya Date Sapatatam Krishnam. In case of Guru Alajata, that's due to that consumption of heavy food, if there is a thirst, Vamana is suggested, and Vamana is suggested in all other variety of Krishna except in case of the Kshayata. Samodbhava Mamsarato Nihanti, Gudodakam Vapi, Athavapi Mantaha. Due to the excess of exercise, if there is a thirst, Mamsarasa or Gudodaka are to be used. Bhaktoparodat Prashito Yavagum Ustam Pibet Mantam Atho Himam Va. If the excess of thirst is produced due to consumption of excess of food, then Ushna Yavagu, warm Yavagu or Mantha also can be given. Ya Sneha Pitase Bhavetya Trishna Tatra Ushnam Ambha Pibet Manushaha. After Snehana or during Snehana, if there is excess of thirst, warm water is suggested. Madhyadbhavam Ardhajalam Nihanti Madhyam Trisham Vyapi Madhyapasya. If the alcohol consumption produces the excess of thirst, then Ardhajala is diluted madhya has to be given, where half is water and half is alcohol. Trishnodbhavam hanti jalam sushitam sa shakkaram sa ikshurasham tatambavaha. In excess of other variety of the Krishna, the water which is cold and with the sharkara or ikshurasa are suggested. Sweetsei Kashahi Vamanantasam Jaroktanani Pachanani. Other Jarokta treatment also can be used with the Pachana Dravyas. Lepa Avagaho Parishachanani Kuryarthata Shita Grihani Chapi Samshodanam Shira Rasavustani Sarvas Lehan Madhuran Himamscha. The other protocols of the treatment could be application of cold substances over the body, or dipping the patient in cold water, or taking bath in cold water, keeping the patient in a cool environment, air conditioned environment, and Shodhana, Shila Rasa Grita, etc. can be the other alternative protocols. Now, in the present day situation, when we treat a patient with the dehydration, the protocols would be, you have to assess the degree of dehydration, and if there is no dehydration, but the patient has a tendency for the dehydration, the causes which could be like gastroenteritis and so on, if there is no evidence of obvious dehydration, to prevent further dehydration, giving maybe oral liquids and supplementing the fluids, mild oral would be enough. If there is a dehydration, moderate or somewhat severe dehydration, always if the patient is conscious, and the patient is able to take orally, oral solution is always better. Supplementing the fluid with the oral administration is always better. If the patient is not able to take oral, even nasogastric tube could be used, by which you can maintain the patient in a dehydrated condition. Once the signs of dehydration occurs, that will be enough. So the preference always has to be given to the oral. But if the patient is in a profound shock and oral administration is not possible and there is an urgency, then IV fluids have to be given, and usually IV fluid should be given in a bolus initially, and ideal fluid in an unidentified cause of dehydration is a normal saline. Initially start with normal saline or Ringer's lactate. And if the and further you have to introduce see whether the patient improves or not. That's how the usual protocol is done. Then the most important aspect of the treating of dehydration now is the oral rehydration or oral rehydration substances, ORS solutions, which are quite common. ORS solutions are again of two categories. Two types. One is the standard, other is the one reduced osmolarity. These days, reduced osmolarity one is more popular than the standard. Earlier, the standard was used. Standard was defined by UNICEF, and the reduced osmolarity is by WHO. And the osmolarity of the standard solution is 311, and ORS WHO recommended is 245. Majority of the products which are available in the market are of WHO standard. That's 245 milliequivalents. That's about in summary Trishna. With this we will conclude. This is Sushrutamitaam Uttaratantre Gayatri Dashamodhyayah Adhitah Ashtatvarimsho Adhyayah. If there are any questions, right, there are no questions, so we will wind up.